Hello everybody, I'm Dr. Burness, and I run a concussion-focused functional neurology and chiropractic practice in Oakville, Ontario. And today I'd like to talk about a common thread I see working with patients with post-concussion syndrome. You know, most of the people that I see, they've been symptomatic for anywhere from 1 to 3 years. So their injuries are, several years old. And in that time period, they've usually done just about everything that, in terms of treatment, they think is available to them. If they're dizzy, they've done vestibular rehab. If they have problems with their eyes, if they feel they can't focus or can't work on screens or whatever, they've done vision training. Almost all of them have been on a treadmill at some point with some doctor, and almost all of them have been either on antidepressant medications or anti-anxiety medications, or they've had those recommended and they decided not to do them. So anyway, with, let's say, a 3-year history of working on their post-concussion syndrome, you would think that with all the doctors they've seen, they would have some idea of their injury. They would know what's wrong with them. So that's a question I usually ask most of the patients that I see as they're coming in is, okay, so what is your injury? And almost every one of them will say, I have a concussion or have post-concussion syndrome. And although broadly correct, that's not specific enough, right? So a concussion is a very general term. Basically, anybody who's had a head bump and lost consciousness is going to be diagnosed with a concussion. There's varying severities, of course. But a concussion is a general term. It doesn't tell you which area of the brain is affected, and every concussion is different. Depending on which areas of the brain are injured, you're going to see different symptoms. Some of the symptoms overlap, of course, like headaches, but you're going to see different presentations for these patients. So some concussion patients are dizzy, others are not. Some concussion patients have difficulty with their eyes, others do not. Some people just have headaches, some have sound sensitivity, some have nausea. So there's lots of different presentations, and those presentations are different because different areas of the brain have been affected. And if you're going to try and rehab something like this, if you're going to try and fix somebody's injury, or if they're going to try and fix their own injury, they have to know what that injury is. You have to focus on the specific area of the brain if you're going to rehab it. And I like to say, you can't fix what you can't find, and certainly you can't find what you don't look for. And most of the patients that I see, their diagnosis has been based on a conversation. There hasn't been a lot of testing done. So what I always tell all of my patients when they're sitting in front of me for the first time when we're doing a consult, it's, if I'm going to be able to help you, I have to find what your injury is. I have to find something, and I mean something specific. And usually, I have a pretty good idea of what that's going to be just based on the conversation, but then you have to dig deeper and actually find the issue. So for example, most patients with concussion will feel that there's something wrong with their eyes. They have difficulty looking at screens, for example, or let's just deal with the screens thing because that's easy. So they have some difficulty with looking at screens, and for some of them it's the brightness of the screen, but most of them it's the oculomotor or the eye activity associated with working on a computer screen, and those eye movements are very specific. If you're moving your eyes up in one direction and down in another, you're using one certain part of the brain. If you're going side to side, you're using other parts of the brain depending on which direction you're going. And you can, if you do the proper analysis, you can figure out, okay, exactly what it is that this person can't do with their eyes that's making them feel there's something wrong with their eyes. So that tells you which area of the brain has been injured. So you absolutely have to know that if you're going to try and rehab that. All right, so that's job number one. If you've been out there suffering with PCS for years, you have to know what your injury is. What specifically is injured? What can't your brain do? And these, I'm talking about eyes right now, but it's not an eye problem. It's a control of the eye problem. So, and that's controlled by the brain. So you have to identify that first of all. And as I say, it usually correlates pretty well with symptoms. If somebody says there's something off with their eyes, or working on a computer makes them dizzy or makes them headachy or whatever, you're going to find some specific oculomotor activity, maybe more than one depending on the injury, that is triggering for that person, and that tells you which areas have been injured. So you have to know that first. If you're gonna rehab something as a doctor, you got to know what it is. You can't fix, like I say, you can't fix what you can't find. You can't find what you don't look for. So you got to look for it. So that's job number one. And then, for all PCS patients, you need to know that. The next thing you need to know is, okay, say you've identified what the injury is. It's the pontomedullary brainstem, the right-sided pontomedullary brainstem, let's say. You have to know what is the capacity now of that injured area or pathway, because the area is not completely disabled. You can still use your eyes somewhat, as everybody out there can, or most people out there can, but it's just not right. It's not strong. It can't do that activity for very long. So an injured pathway is not going to be as strong as a non-injured pathway, and it's going to have a capacity. If you push it to a certain point, if you push it to the edge of that capacity or beyond, you're going to fail. The pathway is going to fail, and you're going to develop symptoms. And usually what happens is when people push themselves past the capacity of their injury, they crash. That's the expression they tend to use, is they crash. I just have to lie down, I have to close my eyes, I have to go to the dark, I have to wait a few hours, and then I'll come back and I'm okay, or I'm reasonably better. So capacity is huge. And in rehab, again, I work with brain injured patients all day long. In rehab, you have to identify that capacity. So you have to be systematic about what you're doing. It's amazing how precise that capacity can be. For example, say we're doing a specific activity with a person's eyes, trying to build up a pathway for a specific movement of the eyes or following or whatever it happens to be. You might be able to do like 8 of those followings, and then all of a sudden either the heart rate starts to go up, or the pupils start to dilate, or the symptoms start to come on. And that 8th repetition, that's the capacity for that activity of that injured area. And if you push past it, guess what? The patient will never get better. If you push them to the point of symptoms every time, they will never get better. And a lot of people are doing that to themselves. If they're trying to rehab themselves, they're doing, very general following lefts and rights or things like that are not specific to their injury, but will wear the pathway down to the point where you've exceeded the capacity and now you develop symptoms. And if you keep doing that, as I say, you'll never get better. You'll just keep crashing and keep crashing and keep crashing and stay the same for years. So you have to know the capacity of the lesion. And as I say, in rehab, we work right up to the edge of that capacity. So in our example there, where they could do 8 and then they failed, that person would do 7. I would have them do 7 of those particular exercises until I see them again, several times with me and then several times at home until their next visit. And then guess what? If they haven't exceeded their capacity, usually the next time you do it, now they can do 9, now they can do 10, right? The capacity is increasing. So they come in with a capacity that's here, limiting, but over time their capacity will go up and up and up. And before long, now you can fit a whole day's work in there within the capacity, and then they can go back to work. So that's the way it works. So you have to, just to reiterate, number 1, where is your lesion? Got to know that. Next thing, what is its capacity? Don't exceed it. And then the last thing that we need to know, I think is important for everybody with PCS, is know that you are inflamed. And maybe you're not inflamed, but let's say act as if you are inflamed. You had a brain injury, act as if there's inflammation in your brain. And I've been working with concussion patients, pretty much full time for 12 years now. I've seen thousands of patients, and I've found out very quickly it's best to assume that every one of them is inflamed and act accordingly. So every patient that I see is on an anti-inflammatory diet. I put them on the diet. And if they don't want to do the diet, then I just tell them, don't waste your money working with me. You know, we need to do everything right to get better. And I'm going to do a whole video on that as well, on doing everything right, because, you know, you can't dabble your way out of this problem. You have to be all in doing everything right. So anyway, so anti-inflammatory diet, super important. We're going to avoid any foods that are immune stimulants for that patient. We can do blood testing to see what foods they're making antibodies to and take it out of the diet. Or as they say, there are a lot of foods as well that, you know, you don't even have to be making antibodies to be driving inflammation. Things like the nightshade vegetables, peppers, tomatoes, white potatoes, eggplant, all these things are all pro-inflammatory for everybody, whether you're sensitive to them or not, so they've got to come out as well. So super, super important to be doing all that stuff. And you know, there's a lot of great doctors out there in my discipline, and medical doctors as well, that are great at what they do. And usually if they're great at what they do, it's because they're covering all these bases, right? You got to do everything right. So that's it for this one, I think. I know it's been a long time since I've done a video. As you've probably already guessed, I'm not a YouTuber. I'm not doing these videos for the clicks or the likes or the subscriptions. I'm just trying to help. I'm getting older now. I'm probably 5 or 6 years away from retirement. I feel like I'm running out of time, and I got to try and reach as many people as I can. And hopefully these videos are effective in doing that. So thanks for watching.